Snoring is a common problem. It is estimated that somewhere in the region of 15 million British adults snore. Robert has been a loud snorer for many years, and he has recently put on weight. His sleep partner now reports that his snoring has decreased. Is Robert now really breathing normally when asleep? Let's find out. At this present moment, Robert is not breathing at all. This is an apnea. Now there is a partial awakening, an arousal. Robert starts breathing temporarily and is totally unaware of this episode. With some effort, Robert takes a few breaths, but soon stops breathing once again. This next apneic episode lasts 1.5 minutes. Let us take a little time to explore what has been happening to Robert over the last few years. Initially, turbulent inspiratory airflow caused the collapsible oropharyngeal walls to vibrate. This produced the snoring noise. This causes the apneic episode. The polygraph that you can see under Robert's video has been created by a device which records nasal respiratory flow, pulse rate and blood oxygen saturation while he sleeps. The red arrow that you can see over the polygraph indicates the exact moment in real time. The upper blue line demonstrates the nasal airflow. The highlighted red sections indicate total absence of breathing. This demonstrates an apneic episode. The thin red line in the middle of the polygraph shows the heart rate. You can clearly see that the heart rate increases dramatically during each arousal. The lower blue line shows the blood oxygen saturation. Each apneic event produces a significant reduction in blood oxygen saturation. Robert is trying to breathe. You can see the small jerking movements of his head, which are resulting from respiratory muscle contraction. You will notice, however, that there is still no air passing through the obstructed pharynx. The movements become stronger, but Robert has not been breathing for quite some time. His blood oxygen saturation drops, and this causes a cerebral microarousal. As a result of the cerebral microarousal, there is a partial awakening, leading to a few laboured breaths. These breaths are clearly visible in the upper tracing of the polygraph. The blood oxygen saturation briefly returns to normal values, but soon afterwards Robert's breathing once again becomes obstructed. First partially, but then completely. Robert soon enters yet another period of apnea, this time lasting 35 seconds. This apneic event is followed by yet another cerebral microarousal and another period of partially obstructed, laboured breathing. The cycle of apnea, microarousal and laboured hyperventilation, with its associated violent swings in heart rate and blood oxygen saturation, is repeated perhaps as many as 60 times per hour throughout the night. As a result of his disrupted sleep, Robert will wake unrefreshed and perhaps may experience excessive daytime sleepiness. His cardiovascular and cerebrovascular systems have been severely stressed. Perhaps as many as 30 to 50% of snorers will suffer from some degree of obstructive sleep apnea. OSA is associated with severe medical comorbidities and increased mortality. Alarmingly, over 90% of these patients remain undiagnosed and are totally unaware of their serious medical problem. Today, it is possible to screen for, diagnose and successfully treat this life-threatening disease. For further information, visit the British Society of Dental Sleep Medicine website at www.dentalsleepmed.org.uk.